Hi, I'm Shannon Chavla with Authentic Healing, and I'm so glad you're here today. I want to talk about the root and the branch. It's a very interesting theory. And, often when we are managing chronic pain or when we are dealing with chronic illnesses, it is really, we go in with all the symptoms, right? We go in with all the things that we're feeling. And that can be seen in Asian medicine as a branch, right? So the medicine that I have learned, we look at the branch as a very important piece, right? When people come in, they're giving all of the symptoms. I have physical pain, I have inflammation, there's tension, I have all these symptoms. And so we want you to feel better, right? So you go see your doctors and there's relief given. And there's many ways that relief are given. Maybe it's through medication, or maybe you're doing acupuncture, or maybe you're trying to do more exercise or taking supplements. There's lists of things that are offered now to help us feel better. However, unless we can really address the root pattern or root cause of what is happening, then we're just continuing to treat the branches. So if we can bring it back into understanding what the root cause is, then the branch treatments actually are more effective. Well, often in chronic pain, this is where people, really get frustrated because they don't find anything wrong, or they say, yeah, you have a slip disc, or there's some, narrowing of parts of your spine, or yeah, we're not sure why you get migraines, or oh, there's some endometriosis, and here are your options, right? So you may get a diagnosis, right? And that can then lead to where you go with that in regards to medications or treatment or care. But I want to look at it differently. And I want to look at it in a way where, well, what is it about treating the root, right? And the way that I see the root is, what are our learned patterns? How does our nervous system respond to life, to pain, to stress? Have we had long-term stress in our life? And has there been any sort of emotional or physical armoring that may have set up tension in our bodies? Now, if you are a human, you've had all of these. And that's just a fact. And that there's times in life where sometimes we have a lot of stress and then other times we don't. Sometimes we have a lot of pain, sometimes we don't. Some people come into this world with chronic pain and they have to manage it forever. And some people, it comes up after an accident or just out of the blue. But that part, it matters, but how we respond to it is the same. It's going in and understanding how we've responded to it in the past, and what are some things that I can do that might actually support a change in supporting what I call the root. So why do we get stuck, right? Well, most of all, they're learned behaviors and also belief systems about healing. So what are your belief systems about healing? Do you believe that you can go and someone will help guide you, or do you have to do it all yourself? Or do you have a belief system that it's okay to endure and that, pain's just a part of my life, right? There's so many belief systems that honestly, most of us don't even know about ourselves, that stay kind of hidden, but they create how we respond to healing and how we respond to pain. So we get stuck again with maybe some ways that we've created in our lifestyles and body armoring and et cetera, et cetera. So what do we do? So first, I always like to acknowledge pain is real. Your body is not broken though. Your body it's responding to something. And it has actually been there to protect you. And the pain response is there to protect you, but after a period of time, it creates a patterning of response. And then the pain just keeps coming back, even though there might not be damage anymore. So how do we heal the root? Well, the first thing that we really need to do is figure out how to create the feeling of safety in our body. When we've been managing chronic pain or chronic illness, often we feel like our bodies have betrayed us. And when we feel betrayed, what do we want to do? We want to run away, right? We want to just push everything away and just get frustrated. So when we start to acknowledge the need for holding all the parts, which is a learned skill, I believe, and it takes practice. But when we hold ourselves in healing, different than trying to fix something. We live in a fix culture, which is the branch. Okay, I got to take this to fix this. I got to do this to fix this, right? We're constantly chasing something. And again, I'm not saying those are not helpful. They are helpful. However, if we want to really create true change, then we want to come back and figure out, how do we create safety in our body? How do we create self-care? How do we slow our bodies down from fix culture into a place of presence, into a place of, okay, body, what do you want? What do I need to do here? How do I hold my pain differently? And I think for a lot of people, when I start having this conversation, they go, what are you talking about? And so let's just do a little practice right now since we're here. So wherever you are, if you could just, if you're driving, probably not a good idea, but if you can, just put both your feet on the ground. And then just allow your hands to drop into your lap so that you're nice and relaxed. And if you can, just close your eyes for a moment. And as you close your eyes, just take a small breath in through your nose and out through your mouth. And right after you do that, just check in and notice where in your body might you be holding tightness, tension, or armoring. You don't need to judge it. You don't need to fix it. Just notice it. All right, whoa. I'm kind of feeling a little tight up in my shoulders. My low back feels like it's a little stuck. So I'm just noticing it. And now on this second breath, nice big deep breath in. And as you breathe out, you just soften. It's very different than relaxing. You allow your body to soften. And this might be new for many people. So it's a practice. What does it feel like to soften a bit? Maybe you can use visualizations of warm water. Maybe you can imagine you're sitting on the beach and you can feel the sunshine just moving through your body. Maybe you prefer where you're sitting by a cool lake in the trees. Find the place that allows your body to feel a bit safe and soften. Taking another breath in and a breath out. This is a practice. Most of us, once we close our eyes and we breathe, we feel all of our anxiety come up, and we feel all of the things we have to get done. So don't try to run from that. Just acknowledge them at first, and then continuing practicing going back to softening. I soften. So this is just a short check-in. I have a whole other video where we do a whole longer presencing check-in that really helps you begin to start to feel comfortable in your body into whatever capacity you can. And over time, it builds. And so when you have a flare-up, when you have some sort of flare-up, notice what your response is, what your response has been for the last, say, 1 year to 6 months. And write it down. What do I do when I have a flare-up? What are the things that I go to? And then you also want to write down, how do I emotionally respond to this pain? And the thing that is so common for people with chronic pain is this judgment, right? We are so hard on ourselves sometimes, right? That, I shouldn't have this pain. I feel like I'm so weak. And I can't really tell anyone because nobody wants to hear what I feel like when I'm in pain. They only want to hear the good things. Well, that's not being a human. So begin to notice how you respond. And then, if you can, start trying to change the pattern. And when you are talking to yourself in a way that is, not supportive of healing, see if you can change that dynamic and that communication. See if you can breathe for a moment and soften. And then even ask yourself, what do I need right now? What do I really need? And sometimes we can respond to that need, and sometimes we have to table it. But as long as we are aware of that response and we're not trying to push it away, we are actually healing the root. And we are not trying to chase and fix things. We're trying to just be with what is. And from my own personal experience with pain, and as a practitioner, when we are with something, holding it fully, that is where change comes. But when we try and push it away or band-aid it or judge it or say, I just need to just push on through, the pain keeps surfacing. And our nervous system keeps down that patterning of the same response. So I hope this is just, something to think about. It's a new way of looking at pain relief, and it's part of your toolbox, right? So when we have any sort of illness or chronic pain, we should have a little toolbox of like, what can I do to support myself in this life, feeling comfortable in my body and in my life. And I'm hoping that this can be in that toolbox. Thanks for being here. If you have any comments or questions, then please do leave them below.